congenital-wise, do you use MR for a lot of your congenital cases?
Yes. Congenital heart defects are not as common as regular problems like high blood pressure affects 1 in 4 Americans.
Oh, right.
Just in comparison, congenital heart defects affect 1 to 2% of all people.
Oh.
So about 1 to 2% of all people are born with a heart defect. For them, it's a big deal.
Right.
Some of them are blue when they're born, and if not operated or treated with medications, would surely die at birth.
Right.
So now with the miracles in intervention and cardiac surgery, pediatric cardiac surgery and pediatric cardiology, these individuals that 50 years ago would die, shortly after birth, are now surviving into adulthood. And I'm an adult cardiologist, and I see them when they reach adult age.
Wow.
So I play in. I'm a teammate of pediatric cardiologists who do all the hard work between 0 and 18 years.
Right.
And then at 18 years in one day, basically we come along and we try to match the excellent work that pediatric cardiologists have done, and getting these individuals with a great head start on life.
Wow. Yeah, this is really touch home.
You're succeeding so far.
Yeah.
Well, we're trying not to drop the football.
Well, I know this really touched home for me because I know I was born with a heart murmur. Yeah, and I was lucky enough that I had one where I could kind of grow out of it, which I believe has happened. I'm not 100% sure. I don't feel any heart problems, but I haven't really gotten checked out for that. Now, when it comes to like, pathologies that are congenital, like heart murmurs, how many different type of congenital pathologies are there?
There are potentially hundreds of different congenital anomalies. The heart actually is the commonest organ affected by congenital defects. It accounts for about 1/3 of all defects found at birth.
That is interesting. Wow.
A heart murmur has to be differentiated from a heart defect. A heart murmur is simply a sound that blood makes as it travels through the heart. And a heart murmur we can hear with a stethoscope. Or
is this something like usually with high velocity? So
high velocity, turbulent flow.
Okay.
Right.
So it may be, there are murmurs. Some murmurs are entirely normal. They're called innocent murmurs. And there are abnormal murmurs or pathological, and that's where we come in and we auscultate, and we obviously will get ultrasound and MR to sometimes categorize these. So a murmur simply means an abnormal sound that the blood makes as it travels through the heart.
I was going to say, because that was actually answers my question. Because I'm curious, I would imagine everybody has a sound
potentially, and we see a lot of heart murmurs
we all have turbulent flow.
In completely normal people. Right. I'll give you an example. When women become pregnant, we often hear heart murmur because the blood travels faster inside the chest, inside the heart. When you're pregnant, your cardiac output doubles, and it's so. The mere friction of blood within the heart can sometimes cause these heart murmurs. People who have other conditions like anemia or infection can sometimes have like what we call a hyperdynamic state, and that sometimes can cause murmurs as well. So we have to differentiate these from abnormal murmurs.
For sure.
Examples of defects. Well, the commonest congenital problem is an aortic valve. That's called bicuspid. So normally the aortic valve is a valve that exits from the heart into the aorta, and it's made of 3 leaflets of about equal dimension. Well, some people are born with partial fusion of 2 of these leaflets, or it's called a bicuspid valve.
Wow.
And that happens in about close to 1% of people.
How detrimental is it?
Well, there's like everything, there's a scale. There's varying degrees.
Yeah.
Some kids are born with very tight valves, and they have a narrowed valve, and they will require intervention, as infants because they have what we call aortic stenosis, which is blockage of the aortic valve.
Is this something you're able to diagnose in a fetal ultrasound?
You probably can. I mean, the fetal ultrasound affords pretty good resolution, and you start. I mean, I think the fetus becomes imageable, if I can invent a new word. I would say probably around 10 to 12 weeks. It's still really, really small of gestation. it grows in size, and typically most ultrasounds are done somewhere between 12 and 16 weeks. I mean, there's variations in practice. Not everybody does it the same way, but I'm saying a lot of people will do it around that time,
Right.
which affords sufficient growth of the fetus to be visible.
Right.
Obviously, you remember that there's amniotic fluid, which serves as a like an ideal ultrasound medium for imaging. So we can use that to better see the fetus. We can do the same views that we get in echocardiography and in MRI for that reason.
Nice.
We can also do MRI even on pregnant women.
Peter Road.
I was going to ask you about that, like the risk versus reward. One thing that we can offer for safety with the patient is protection from the 130 decibel sounds that they're
Right.
but we're not able to add protection to the patient or to the the fetus.
That's right.
So you have to weigh the risk versus reward.
Yeah, we use it, again, it's a second line exam. I've used
Right.
it for congenital heart defects where I'm not getting the full answers to my question by echo, either because the acoustic windows aren't great, or the problem is complex. For example, imaging the right ventricle
Right.
in someone with a really abnormal heart. The specific case I have in mind is someone with transposition of the great vessels, where you have inversion of the ventricles, or in other words, the right ventricle goes into the aorta.
Yeah.
It's complex, but
Yeah.
so I've used MRI. Typically, we will not image pregnant women before 12 weeks of gestation, and we will obviously not use gadolinium.
Right.
But
that was going to be
but you can get a lot of information with a dry and obviously for the reasons you mentioned, we don't do like these exams are very, very focused.
Right.
We look at function. We can, for example, look at these exams can usually be done in very efficient states in between 15 and 30 minutes. So we're trying to really cut down on the amount of time that the fetus is exposed to.
one thing I'm curious about, I've never considered before, is with the fetus development. My understanding, forgive me if I'm wrong, I probably am, but my understanding is that typically the lungs develop later in gestation. So if a patient if a baby is premature, typically they have respiratory issues. But what I'm getting at, is there a window of weeks in which the baby's more susceptible to congenital heart development?
The heart in itself forms between, it starts at conception, but all the mechanics of the formation of the heart, if I may say that, what we call the embryogenesis, is between 6 and 12 weeks. That's when the closure of the holes of most of the holes inside the heart occur, where the valves form, where the two circulations are separated, the circulation to the lungs and the circulation to the systemic circulation. Now, the thing with fetal physiology is that obviously, as you said, Robert, you don't breathe. Fetuses don't breathe. They're in amniotic fluid. There's nothing to breathe there. So the lungs, although they develop, are not. There's not much flow going there because the function doesn't isn't ready yet, if I may say it.
Yeah.
So you get about, let's say, 10% of your blood flow that goes to the lung. So that's why most of the blood flow is directed towards the systemic circulation to nourish the brain and the developing organs and the lungs, obviously, because they have to develop too.
Right.
The lungs will continue to develop for up to 2 years following birth. So they can, the architecture and the arteries and all. Your question probably refers to when are fetuses ready to start breathing and live?
Well, I guess more my question was, is there a certain point where throughout, your 40-week gestation where you feel like we've made it past that point where we know their baby's healthy. We know if they don't have it at this point, then we know we're good, right? I mean,
usually your lungs are, major problems will be present usually at 12 to 14 weeks. You should be able to identify, and that's why we do the fetal echo or MRI at that time. The maturity of the lungs to be used to breathe normal air takes more time. there's something in the lungs that's formed that's called surfactant, which helps basically maintain the alveoli, which are like airbags within the in the lungs, if I may say that. and that compound, which takes a little bit of time to form, is available like when a baby reaches beyond 32, 33, 34 weeks. That's when
I know a little bit about this because my son has asthma, and my understanding is that's kind of where patients with asthma have the issues, is in their alveoli, and that's one of the late developing.
Asthma, it's more, from my understanding, and I'm not a respirologist, but it's asthma may be in part that, but I think it's mainly what we call the airways. So we call this reactive airway disease. Mm-hmm. So before the airbags or the alveoli lie obviously the bronchi and the bronchioles, and these are small passages, airways, through which air travels in order to get to the lungs. And I think a lot of the people that have asthma have problems more with the bronchi and the bronchioles. Sometimes this is made worse by viral infections that many kids get. We all have to pay our dues in terms of acquiring immunity. So we get exposed to virus, we build our immune system, and sometimes in the process, we have some kids have more issues with reactive airway disease. So, and that's typically treated with what we call bronchodilators, which are medications that help these loosen the muscles of these airways, because there's little muscles in them as well.
I mean, this is awesome. We got a cardiologist we're sitting with, Reggie.
I got to be careful. I'm skating on thin ice.
Well, I mean, we're trying to.
I think it's interesting too, because is it more common if you have congenital, like say a lung issue, will you also have like congenital heart issues? Is it like one of those things?
It's tied together, Reggie.
Right.
So it's a good point you make. We sometimes find that a lot of these patients will have mixed issues. Obviously, the heart and the lungs are a team. They work together. They're a unit that helps. Well, their major function is oxygenation, the blood, and basically circulation. As this tight unit, this team of the heart and the lungs, if the heart's not good, then often the way it manifests itself is through the lungs.
Right.
If you have heart failure, one of the manifestations is that you may develop water on your lungs because the flow isn't efficient. So in adults, what we call heart failure, or pulmonary edema rather, is one of the ways that people will manifest with.
And to tie that to MR, is that the reason why we do that large field of view through the lungs?
I think it's a big
cardiac
advantage.